We're talking about that loud clap of thunder that's making a lot of rounds on social media. People are saying, yes, loudest they've heard in 60 years. Somebody else said really loud rolling thunder for a surprisingly long time. It was odd and definitely rattled the windows. Somebody else said bright lightning and huge clap of thunder at 8:15-ish. I'm in Metairie and near Metairie Road in Severn. Somebody else said WWL Radio weather whiner. It's just rain. Geez, that's the same person that if it were to rain and flood would say, why didn't you tell me? People, you got to love them. Dr. B joins us now. Dr. Brent Wallis, Chief Medical Officer of People's Health. Talk about heat-related illnesses. How you doing, Dr. B?
Hey, Tommy, I'm doing great. How about you?
I'm okay. Did you hear a loud clap of thunder at 8:15 last night or not?
I did not hear anything at all.
I didn't either. I don't know. Maybe I was soundly asleep. And if that's the case, maybe it indicates like somebody could murder me in my sleep. And the only thing I ask is don't wake me up first if you're going to do that. July is one of the hottest months for Louisiana. As the temperature rises, so does the risk of heat illnesses. And Dr. Brent Wallis, our friend, Chief Medical Officer of People's Health, is going to share some warning signs of these conditions and some tips for staying cool. Cloudy today, not so much of maybe a danger, but it can still be cloudy and hot. What are heat illnesses, Doctor?
Yeah, so we see these every summer, even on some days like this because of the high humidity, it still gets pretty hot. But heat illnesses happen in these high-temperature areas. Louisiana is a hot spot, literally. And what happens with heat illnesses is your body overheats and it cannot cool itself down. And there's a whole bunch of different heat-related illnesses, but the two that we see probably most common are heat stroke and heat exhaustion.
Let's talk, about heat stroke. We'll start with that one.
Yeah, and heat stroke is actually really the most severe heat-related illness that we see, and a lot of people don't realize, but it's actually a life-threatening medical emergency because if you don't get quick treatment from heat stroke, it can actually lead to brain damage. Your organs can actually shut down, and people die from heat stroke every day. And, the symptoms that we see and that you really need to watch for, or if you're with a loved one and you start seeing some of these things, this is where you really want to do something about it as quick as possible. We usually, with heat stroke, will see a really high body temperature. It's usually 103 degrees or higher. And then their skin is usually dry and red, so we call it hot skin as opposed to that kind of clammy, wet skin. We typically will see a fast or strong pulse, and the individual may have a really throbbing headache and complain about a lot of pain in their head. They may have some nausea as well. And heat stroke affects the brain. It affects the central nervous system. So you can have things like seizures. You can lose consciousness or get confused. Mental state can completely change. And so sometimes people will be slurring their speech or really not know exactly where they are or what's going on.
From what you're describing, it would seem as though time would be of the essence on something like this. So what happens if you're experiencing this or you see somebody that is experiencing these symptoms?
Yeah, you're exactly right. I mean, like I said, this is a life-threatening medical emergency, so you want to call 911 right away if someone's having any of these symptoms. While you're waiting for help to get there, it is important to try to cool the individual down. And, so if they're outside, bring them in to the air conditioning, try to let them get a little bit cooler. You can use cool water, a cold shower, and often what I tell people to do is cold compresses. Put little cold compresses kind of in the creases of their bodies, so in the armpits especially. That'll help cool their body down.
What about heat exhaustion?
Yeah, so heat exhaustion is a little bit different. It's not as severe, but it can lead to heat stroke. So it's kind of like a warning sign. And one of the biggest differences is that you typically don't see those mental status changes, and it's not considered life-threatening. But again, if you don't cool down, this could progress to full-on heat stroke. So typically what you'll see in these individuals is, rather than the dry, red, hot skin, you're going to see skin that is really cool and maybe clammy. These people, rather than being dry, are going to be sweating profusely, so really wet skin. They're going to have a weak pulse, and it'll be very, very rapid, but they may not have an extremely high body temperature. And just like heat stroke, they could have nausea or even vomiting, but more often they're going to be complaining of things like muscle cramps.
All right, let me take a break. We'll talk about who's at risk for heat illnesses when we come back, some tips for staying cool, drinking water, and more with Dr. Brent Wallis, Chief Medical Officer of People's Health. I got on Cut the Grass yesterday to try to get ahead of the rain, and even though it was drizzling, it was still miserably hot. 8:20 traffic now, WWL. 8:24, Tommy Tucker, WWL, talking with our friend Dr. Brent Wallis, Chief Medical Officer of People's Health, about July being one of the hottest months in the year, and heat-related illnesses, heat exhaustion, heat stroke. We've already discussed that. Who's at risk of these illnesses, Doc?
Yeah, I mean, it could be anyone, especially here in Louisiana, but we typically will see it more often in younger children and older adults in particular. And the reason for that is because those age groups tend to have more trouble staying hydrated. Hydration is really critical to cooling your body off, and they can have more trouble regulating their temperature. And then, the other groups that are at risk, anyone who works outside, in Louisiana in a hot, humid environment is going to be at risk. But in particular, people who take certain types of medications, a lot of medications can dehydrate you, and that can increase your risk as well. And then certain health conditions, in particular diabetes and heart disease themselves, those disease states can make it more difficult to cool down. So your doctor or your pharmacist can help you understand what those risks are.
When it comes to being hydrated, Jordan Fiegel, our producer, it taught me this a long time ago. I was not feeling well the other day, and I thought, you know what? Let me drink a couple of bottles of water, and I did, and I'll be darned if I didn't feel a whole lot better. So when it comes to dehydration, a lot of people are dehydrated, are they not, Doc, and don't realize it?
Yeah, all the time. I think people definitely don't drink enough water, and you do get kind of those vague symptoms that make you feel kind of bad, and water will usually help. By the time you're thirsty, you're already dehydrated, so you need to be preemptive about making sure you drink enough water.
Why is it so important to stay hydrated?
Yeah, so the most important thing about hydration is that allows your body to sweat. And if your body cannot sweat, then it cannot cool down. That's our primary means of cooling down. So that's why you really need to make sure your water levels are high enough.
How about people that don't like to drink water? They struggle to drink water.
Yeah, a lot of people don't like water. They, prefer flavored beverages. And so one thing you can do is flavor your water. But, don't flavor it with a whole lot of sugar. You can do a little bit of citrus or some mint. There are packets that are without sugar that can actually make the water taste a little bit better to you. It's really good to carry a reusable water bottle. I do that all the time when I'm traveling so that you remember to fill it up and drink a little bit of water. And if you really don't like the water, there are a lot of foods that are rich in fluids. And so things like cucumbers and celery and tomatoes, anything you bite into and it kind of squirts a little bit, that's going to give you extra hydration as well. And then be very careful about sodas, because they have a lot of caffeine. Caffeine is a diuretic, so it's going to dehydrate you. And the same is true of alcohol. A lot of people can develop heat illnesses from drinking as well.
Some other hints for staying safe in high temperatures?
Yeah, I mean, one of the biggest things is try to avoid direct exposure to the sun. I mean, if you go out here at noon, it's going to be the hottest that it's going to be all day usually. So try to stay inside when you can. And the other thing to keep in mind is if you do have to be outside, make sure that you're wearing the right type of clothing. So don't wear super tight clothing. That's going to keep the heat in and make it more difficult for you to cool down. So you want to wear kind of looser clothing that allows more airflow. And that's important also because the other risk you have during the summertime here is sunburn. And we know sunburn is very bad. That can lead to a lot of other problems. And so you want to make sure you're wearing clothing that's going to cover your skin and protect you.
And I guess sunscreen's important as well?
Yeah, absolutely. Pretty much year-round, but especially during the summer, if you're spending any amount of time outside, you want to wear sunscreen. It should be water-resistant. The other thing to kind of keep in mind, you can use those cream sunscreens, maybe just about 2 tablespoons of that, but you want to make sure you put it on at least 30 minutes before you're going outside. It needs a little bit of time to bind to your skin and provide that protection. And if you choose to use the spray-on sunscreen, make sure you rub it on, because it's going to go on in these little micro droplets, and it's going to leave areas of your skin exposed, so you've got to rub it all in.
Final advice?
Yeah, I mean, sun safety is really, really important, living here in Louisiana, the entire summer and really even into the fall here as well. So just be very careful about those heat-related illnesses. They can be very dangerous. Make sure you protect yourself from the sun and make sure you stay hydrated.
I certainly don't want to inject you into the vortex of any controversy, but quickly, when it comes to sugar, whether it's corn fructose or cane sugar in soft drinks, you need to be careful about how many soft drinks you have a day, correct?
Yeah, I mean, just like most things, moderation is really key. Having a little bit of it is usually not too bad for you, but, drinking those all the time can have a lot of increased health risk and lead to a lot of disease.
Thank you, Doc. Appreciate it. You can find out more about People's Health by visiting the People's Health Medicare Center. That's in Metairie, 3017 Vets. It's located between North Causeway Boulevard and Trader Joe's. You can't miss it. Appointments are recommended, but walk-ins are welcome. You can also visit their website at peopleshealth.com, or you can call them at 1-800-978-9765, peopleshealth.com. We're going to take a break. We come back. We'll talk to Steve Nelson, General Superintendent of the Surge and Water Board of New Orleans, talk about the rain event, about summer weather, and also about a raw sewage discharge that happened, so stay tuned for that. And then in the 9 o'clock hour, we're going to talk about accents, New Orleans accents specifically. Dolan, right now, time for WWL First News. For that, we go to Dave Cohen.